Hi guys, I'm Dr. Ayeli Okine and this is This Vet Wants You to Know. It's been a while since I posted a longer video for you, but in light of some things going on with my own dog, I decided today to post a video on just some considerations for when your pet isn't feeling well, primarily when they're having vomiting, diarrhea, or just not eating. The first thing to consider is, overall, how are they feeling? One bout of diarrhea or a single bout of vomiting in a dog that otherwise is very bright and happy, that's doing well. I don't tend to get too worked up about that. But if in your dog or cat were having diarrhea, vomiting, and they're not feeling good or they're not taking in food or water, then I'm much more concerned about what could be going on. And I always recommend in those situations for additional tests to be done. The other thing to consider in the beginning is how important is it for you to get an answer about what's going on, because that definitely is going to change how I, as a veterinarian, help you. If we start down the path of treating and making, educated guesses about what's going on, that might interfere with later testing, and it may make it really hard for us down the road to go back and try to figure out what started all of this from the beginning. So if it's going to be really important to you to get an answer, I would recommend doing tests in the beginning and being much more proactive. Because again, I'd hate to go down the road and things don't go the way we want them to. And sometimes you can still get an answer at that point, but there are things, especially with infectious diseases, that if you start down one path and start medication, sometimes that does interfere with the later test. So I would keep that in mind as well. Typically for younger patients or patients that have a really sudden onset of symptoms, we call that acute gastrointestinal symptoms. The workup's going to be a little bit different than if they've had symptoms for a longer period of time. And so when things are happening acutely, I tend to worry a bit more about things like foreign bodies. I tend to worry more about things like infectious diseases, things that really take a patient from feeling normal one day to feeling sick the next and happen very suddenly. And so in those situations, I think it's always a good idea to get blood work. Blood work is what we call the minimum database. That's going to allow us to look at their overall metabolic status and also to make sure that electrolytes and things are staying normal in these patients, because as they're having a lot of fluid losses with vomiting and diarrhea, that can really change their electrolytes. And sometimes that is important to know so that we can correct it and make sure that we're keeping them as stable as possible while we do this workup. So blood work to me is always going to be important no matter what. I think it's a good baseline to have. The other thing too that blood work does is it may not necessarily give us the answer, but it gives us a place to look. So for instance, if we have an older dog that's not feeling well and there's elevations in the liver values or the kidney values, well, those are places that I'm going to look first. So rather than spending a lot of time maybe looking at infectious diseases, I want to know what's happening with the liver and kidney first, because that might be where the problem is. Versus if everything's looking really good, then we can kind of start from the beginning. So I think blood work in some cases can help lead us in the right direction, especially if there's something else going on besides a problem with the gut. Typically, again, for more acute problems, I mentioned infectious diseases, foreign bodies, that sort of thing. Getting a stool sample and analyzing that for parasites and also for bacteria and viruses can be really helpful, especially if we have a patient that, again, is young, that, this is their first time maybe being exposed to these things. If we have a patient that is interacting with other animals, those are going to be really important things to do. And there is a fecal parasite test, which is looking for parasites. And then there's also DNA panels. We call those infectious PCR panels, where they're actually looking for DNA of different infectious agents. And that can be really helpful to look for some infectious things that are harder to find in other ways. So those are really helpful tests to do on a stool sample. There are infectious diseases such as Campylobacter, for instance. Campylobacter is a bacteria that we can see cause gastrointestinal symptoms in cats and dogs and people, and it actually is communicable. And the important reason I'm kind of mentioning this bug in particular is the treatment's a lot different for sort of your run-of-the-mill, I just don't feel good. The antibiotic is going to be very specific to this bacteria. So knowing that ahead of time can be really helpful to get the patient on the right treatment, because they might not respond to other things that aren't directly attacking that bacteria. Things like E. coli, salmonella, other bacteria that we can sometimes see in like raw diets or contaminated foods, or again, dogs that are maybe coming into contact with other pets' raw food or other pets' bowel movement. So those are important things, because the treatment's going to be a lot different than a lot of the supportive care medications that we're using for, non-specific or kind of just general pets that aren't feeling well. Excuse me. So those tests are really helpful. The other thing is sometimes these infectious disease panels aren't going to pick up parasites and bacteria that aren't necessarily shed regularly. And so in some cases, we need to test the sample more than once or collect a couple of days worth of samples to be able to submit. The fresher, the better. Keeping them in the fridge, I know that sounds gross, but if your pet is having a bowel movement and you're worried you might need to go to the vet, actually saving a sample can be really helpful, but we need to try to run it within about 24 hours. The other thing that is sometimes done in these cases is we also might need to culture the stool. And so there are some bacteria that maybe we won't pick up on the DNA panel, but culturing it and actually growing it and amplifying it can be really helpful. And so those are situations where, again, we want to do that before antibiotics are in the system, because antibiotics might inhibit growth. So all of those things are really helpful to know. So doing those tests can be helpful. If we have a patient that's really not able to keep things down or isn't eating, doing imaging can be really helpful. The difference that I kind of explain to my clients between x-rays and ultrasound are x-rays are going to give us an overview of everything. So it's kind of like looking at a forest from afar. You don't necessarily get all the details of the trees, but you're looking for the pattern and you're looking for, okay, is there anything major out of place? There are foreign bodies and things that are really dense that can show up on x-rays. You can see patterns where if the intestines look really dilated to a point, radiologists can say, hey, I'm worried about a foreign body, but you're not really getting all the detail of the different organs. And so there's a lot that you're going to be missing with an x-ray. So if you don't see anything obvious, it doesn't mean it's not there. It just means that wasn't the test to give you the answer. An ultrasound can be really helpful to get the detail of all the different organs and actually see if you can see a foreign body. And so that's something that I recommend in these patients that are really, really sick, or if they're not able to keep things down, they've been vomiting a ton, it may be worth doing the imaging sooner rather than later to try to get an answer. The treatments, again, really go along with what is the history on the patient. If a client changed a diet and the pet suddenly started having vomiting or diarrhea from that, well, maybe we need to go back to the old food and support the patient through that. And maybe we don't need to do a whole lot of tests. And so supportive care medications, antidiarrheals, anti-nausea medications, appetite stimulants, fluids, all things that we can consider. But again, if it's not that straightforward, if we don't have something definitive to go back on and say, okay, we think this is what caused all of this, then we might need to look for other things. If we can have a diagnostic that gives us the answer, so if we can get a positive test, then we have a specific treatment for that. That can be really helpful. And again, if a patient's really, really sick and not able to keep things down or isn't taking things in, or they're losing a lot of fluids, if they're losing more than they're actually consuming, they may need to be hospitalized and go on fluids to really help with that. So again, the presentation and the history are really important. Also, our physical exam is very helpful too. If we have a patient that has a really painful belly, well, then we're going to worry a little bit more about a foreign body. And so that might drive what we do in that situation. With more chronic cases, I still think it's not a bad idea to rule out infectious diseases. But there are situations where if we've had a patient that has been having symptoms intermittently for, weeks, months, years, well, then it's probably not going to be something infectious. In that situation, we might need to take things a step further and actually consider getting biopsies of the gastrointestinal tract so that we know for sure exactly what's going on a microscopic level. That can also still help us look for infectious agents as well. But if we're having more chronic symptoms, then we need to do something a bit more aggressive. Other things, steroid trials, changing the diet, those are all things to consider as well. But again, I think depending on how aggressively you want to look from the beginning and get to an answer, that really guides what we do treatment wise. So these are all things to keep in mind. It's never wrong to try some things. I never want to spend all of an owner's money doing the test and then having no money left over for actual treatment. But I think the fewer diagnostics we do, the less certain we're going to be about the answer. And so there's going to be a level of uncertainty. We're not going to be able to tell you what's going on, the expected time frame, for a response, how long is a pet going to need to be on meds, what's the survivability of this, what's, the length of time we expect them to do well. These are all going to be questions that we really don't have the answer to. And so I think when you go into it doing more of the empirical, educated guess, we're treating based on that, there's going to be less that we're going to be able to offer as far as answering some of these things. So anyway, just my thoughts about vomiting and diarrhea and decreased appetite in dogs and cats. Again, if you think you want to know the answer, do the testing from the beginning, and that way you don't have to worry about missing something. It's also important to remember that sometimes we don't find an answer. But doing testing, it's just as important to rule things out as it is to get a definitive answer. And so I have seen owners get frustrated by doing tests, spending money, not getting an answer. But you also have to remember that those are things that we've ruled out. So if we do an ultrasound and we're not finding a foreign body, that's one thing we can rule out. If we're doing infectious disease testing, and we're not finding anything, it's probably not those things. And so it can still help us narrow down what's going on by ruling things out. And so it's important not to get frustrated by negative test results, because negative test results are helpful as well. All right, well, that's all the time I got for today. I hope you enjoyed this video. Please follow, please subscribe, please like this video, leave a comment. Many of you, if you follow me on social media, know that my pet just recently went through, he's still recovering from a bout of diarrhea and not wanting to eat. And so some of these thoughts came up because of what was going on. So again, thank you for your time, and I will see you in the next video. Bye.